Obtaining quality medical care is difficult for tens of thousands of people in remote and rural areas of South Dakota. But a well-funded charitable group is trying to change that grant by grant. I'm South Dakota Newswatch reporter Bart Fancook. In the latest piece published by Newswatch, we examine the potential impacts of a lack of access to medical care in rural regions and show how hundreds of millions of dollars in philanthropy are making a significant improvement. To get care for any serious medical condition or one that happens after 5 p.m. or on a weekend, the roughly 350 residents of Bison, South Dakota must drive 120 miles each way to be treated in Mobridge. As medicine and medical procedures have continued to advance in recent years, much of rural America has been left behind. Improving services and installing new technologies is expensive, and experienced physicians often do not want to live and work in remote areas. Studies show that rural residents have higher mortality rates than those in more populous areas as a result. To reverse the trend, the Helmsley Charitable Trust is spending millions of dollars to buy new technology, better trained doctors, and promote telemedicine to improve access to healthcare in rural areas. Funded through the $5.5 billion estate of hotel magnate Leona Helmsley, who died in 2007, the trust fund has spent nearly $400 million on rural healthcare programs in 7 Great Plains states. The trust has spent about $100 million in South Dakota over the past decade on programs to treat cancer, enhance robotic surgery, improve mammogram imaging, and better train emergency responders. Next up, the Helmsley Trust plans to invest in new technology that may allow specialized surgeons using a joystick to direct robotics that will perform open-heart surgeries on patients hundreds or even thousands of miles away, bringing life-saving technology to remote rural areas of America. For much more on this story, please go online to sdnewswatch.org. Thank you.